Namaste. For next few minutes, we will talk about administration of blood products, which is a very basic procedure that is carried in and out, and also a very complex with regard to its nature and the adverse events that can follow due to it. So my talk will be based on following contents, namely the consent, educating the and history taking, assessing parameters, and goes on with the monitoring and vigilance, and end up with the documentation of the process. The first one important thing, whenever you decide to transfuse a patient or you have made a decision to transfuse somebody, the first thing is to obtain and what is called as an informed consent. And what is this informed consent is, you have to tell the patient or the recipient of the blood products in detail as to what this procedure is going to be, why it is necessary, and how it will be done. So how frequently should we take consent? Consent should be taken ideally with every episode of transfusion. That means to say, on a single day, if you are transfusing around 2 or 4 units of packed red cell with some platelets and FFP, that would account for one episode or one event of transfusion. And you repeat it the next day for a different indication or something, that should be recorded. Sometimes in chronic transfusion, the patient take transfusion regularly and repeatedly. It's ideal to take the consent every time the patient is admitted to the hospital or you are going to plan the transfusion. So in your obtaining the consent or the consent form, you should clearly mention the indication for transfusion, the risks, the benefits, and the possible effects of transfusion clearly in a language understood by the recipient. And also, it's imperative to make a note of alternatives if anything is possible to the transfusion, and this right to choose the transfusion has to be always with the patient. Of course, you can educate them and motivate them and also explain the benefits and get them into the context, but it has to be always chosen by the patient. The next thing obviously is educating the patient or the recipient. When you educate somebody about the transfusion procedure, you have to tell how it is going to be, what all things is expected from him as a patient, and what are the possible injuries or the time taken and all that clearly into the patient. And one more thing important with the administration of blood products is, it's always, whenever a transfusion reaction or something goes wrong, it's the symptoms that appear before signs. So though you monitor for the vitals like BP, pulse and all that, it's always important, symptoms appear much earlier than the signs. So if the patient has to report the symptoms to you, he should know that this is due to transfusion. So for that to happen, you have to clearly inform him about what are the types of symptoms or what are the panic calls. He should draw the attention of the attendant or the doctor immediately. So that has to be clearly made him, told to him, and he should understand that. The next most important thing is history taking. So with regard to, of course, with the possible medical history in brief, the other particular history that you have to take before transfusing a patient is, were there any previous transfusion that he has already received? If he has received, what was the outcome of the transfusion with regard to adverse reactions, if any, and if at all he had reactions, complete details of the reaction, what happened, how long it persisted, and sequelae, if any, left beyond the previous transfusion, and also any special arrangements or medications that he was taking or the way in which those transfusion symptoms were treated has to be known in hand. And of course, comorbidities existing with him like fever and other things, hypertension, should also be taken into account so that it helps you monitor the transfusion. And of course, as I said, medications, you should also ask for various medication histories that may either interact or cause any blood transfusion to be detrimental if taken with medication or going to alter the course of the therapy or something like that should be clearly obtained. Once that is done, the next is the examination of the patient, where you assess the baseline parameters of the patient, obviously the vitals, which includes the pulse, BP, temperature and respiratory rate, and also sometimes oxygen saturation and all that. It's very important because most of your transfusion reactions objectively can be picked only if you have a baseline parameters. For example, if you tell that a febrile reaction was reported due to transfusion, obviously you should have a baseline temperature of the patient with connection to which you say there is an elevated temperature of 1 degree, 2 degree or whatever. In the same with BP, whenever a patient goes into hypotension or hypertension due to transfusion, you should have a baseline against which you can always compare and attribute it to transfusion. Optional things like ECG and also are being used in some of the occasions. And also you should always be ready with the equipments in case of emergency. Once if you have decided that transfusion is to be going ahead, the next thing is you have to collect the sample from the patient for various pre-transfusion testing that should be done. So when you collect the sample, ideally you collect 2 samples, one in EDTA and one in a plain, and they should be labeled with at least 2 unique identifiers like name and hospital number, or name, age. Hospital number is unique in the sense there won't be any repetition of the hospital number, which is not the same with regard to name and other things. And also the date and signature of the phlebotomist who has collected the sample should also be clearly mentioned on the sample. Fresh sample has to be taken after every transfusion, and a sample should not be more than 3 days old for conducting the pre-transfusion testing. So once the sample is drawn, next is how to write a blood order. So that's a sample of the blood order that is shown there. What all things they should include is, first is testing and preparation required. This is the order that you give to the blood bank when you want to take transfusion. So the first order is usually what are the necessary testing that is required. For example, you may require an Coombs test to be done, or aliquoting of the sample or something that has to be done. And the second order is for the issue, that is when you actually need the blood. Do you need it now, or you want the blood to be ready and you would be taking it after some time? This is what you have to mention. And so usually 2 orders are written. The first order is usually sample to be grouped, the patient to be grouped, and also to be cross-matched and kept ready. And the second order is usually for you to, for the blood bank to issue the blood product. When you write an order, you should clearly mention the indication for transfusion and diagnosis of the patient. You should always know the difference between diagnosis of the patient and the indication, because diagnosis is what the patient is admitted for, but indication would be something like a thrombocytopenia or a newly occurring anemia. A patient may be posted for cholecystectomy, that and his diagnosis would be cholecystitis, but the reason for transfusion would be maybe a pre-existing anemia or a post-operative blood loss leading on to anemia, something like that. So indication for transfusion is different from the diagnosis of the patient. So once the blood is requested, you should also ask for any preparation of the blood unit if required. Like whenever you request for an FFP, it has to be thawed and sent to you, or you want it to be pooled and given as a single aliquot, or you also want it to be diluted before transfusing, maybe due to viscosity or something like that, or you want the blood products to be modified in respect to filtering and all that. That has to be clearly mentioned in your form and sent. Then there is a very casual practice of giving medications to the patients whenever they are supposed to undergo transfusion. The evidence suggests that there is no clear-cut indication for this, because the school of thought is that if at all you give a pre-medication, it will usually subside the initial early symptoms of transfusion reaction, but a bigger and a life devastating kind of adverse reaction can happen later. So to avoid that, it's said that do not universally medicate your patients before transfusion. Of course, there may be a medical order for insisting to do that with a proper justification from the physician. Only then you can give the medications. And whenever you are giving medications, keep that in mind. Whenever you are giving a prophylactic oral medication, you have to give it at least 30 minutes before starting the transfusion. And if it is in case an IV drug administration that you are giving as a pre-medication, it should be at least 10 minutes before the transfusion. So accordingly you should arrange. The other thing is, once this is done, next is arranging an equipment. What are the equipments required for blood transfusion? For example, sometimes blood warming may be required in few conditions where the patient is an neonate, or he is an hypothermic surgeries, or he is himself at a risk of hypothermia. Blood may be required to be warmed. So the blood warmers should always be used for warming, and no other practices like thawing in a water bath or putting in a bucket or a bowl of water. All these things are not recommended, because any temperature above 50 degree can destroy the RBCs, and a lysed RBC can be very detrimental. And infusion pumps, in case you want to monitor the count of the flow rate or something like that, or pressure devices when, especially in casualty or emergency where you need to give blood at a very higher speed, you can make arrangements of that. And all these things has to be arranged even before you procure the blood and start your transfusion. And of course, the emergency tray crash with all the medications, the ventilatory source and the oxygen source has to be kept ready. And also it's imperative to make sure that these are all in working condition before you start somebody on transfusion. The next important thing is obtaining an IV access. The acceptable sizes are from 22 to 14 gauge needles. Most of them can be used for blood transfusion. Generally, for adults you use 20 to 18 gauge needles, and for the infants you can go up to 25-24 gauge as long as infusion devices are applied. So a very small gauze needle can compromise the blood products, especially the cellular ones, when RBCs had to move under shear stress and through a very narrow cannula lumen. So always choose the biggest cannula applicable for that particular type of patient. So these are the sizes of various gauges and their colors shown for indication. You can choose most of them. Ideally, not usually more than 20 gauge needle. The next thing is to be ready to transfuse. There should not be any delay in start of transfusion from the time the component has arrived at bedside. It's a very important. The golden rule of 4 hours out of the refrigerator should always be practiced for all the blood products, especially the ones which are stored in refrigerator like RBC. And these 4 hours includes the time for transfusion. That means to say, from the time the blood is removed out of the refrigerator, within 4 hours the transfusion should be completed. So if there is any inadvertent delay that you expect in transfusing, please make sure there are alternative arrangements made to store the blood either in a refrigerator or as the blood bank, to just keep it ready and collect it when you are really ready to transfuse, because most of the time blood get wasted, or it can cause lysis of the product, or the products may not be effective enough because the storage conditions alter when you get it from the blood bank. In most of the hospital based blood bank, it's just one floor or within a 50 or 100 meters, but many times it has to be traveled or transported across the buildings and sometimes through road over a long distance. And also it's possible that sometimes the blood bank is away from the hospital and you have to carry the blood, and you also ship blood sometimes. During all this time, make sure that the blood is transported in the transport boxes that are meant for usage in transporting these blood products. And also make sure whenever you carry it in a vehicle or something, do not keep it near hot, the engine side, or a place where the vehicle is expected to get heated up or something like that. So ideally always transport them in transport boxes and keep away from the heat resources. And also when you keep inside the box, make sure that the blood is not in direct contact with the ice. So you have to arrange the ice packets around the box inside it, and probably keep a gauze or a cloth or something so that blood is not in direct touch with the ice. Once all this is taken care, the next one is just before administration. The most crucial step is verification of the product with the patient, because most of the time, irrespective of the hospital or the setting, it's noticed that the most common reason for a transfusion reaction is always a clerical error or a mismatched blood product. The patient A was transfused with a blood product which was supposed to go to patient B. So always make sure that an identification of the recipient and the unit is done, ideally by two different people at the same time. You can have a nursing assistant or somebody who checks all the details. You read out the number. If the patient is vocal enough, read out the name, read out the hospital number, ask it is pertaining to him, and then only start the transfusion. And also the other thing, important thing that has to be noted, the one most crucial thing is the hospital number of the patient, which is very unique and it doesn't repeat. And the other thing is donor or the donation identification number, which is written on the blood product. And then also look into the type of the blood, known group of the patient, and what is the patient, the blood that has arrived, blood product. And also look into the medical order of the patient as to any special instructions has been given with respect to how to transfuse blood, what is the rate to be followed, or any necessary precautions that to be taken up. And also, if applicable, make a note of the expiration date and time, if at all, written on the blood products. So that is the checklist that has been shown, which has to be ideally signed with two different people before starting the transfusion to make sure that the correct product is being transfused to the correct patient. And that is the final check. You have to check the blood product there, the barcode or the label of the patient that is written, as well as the cross-match receipt that you have got from the blood bank. So once all this is done with a patent IV access, you can start the transfusion slowly. Before starting, it's always, as I said, you have to monitor or record all the baseline parameters before starting it. And once you connect the blood set, you have to monitor the transfusion. Ideally, initially you start the transfusion very slowly. The reason is, whenever you start the transfusion very slowly, it's known that most of the reactions that happen to the blood products usually happen within 20 to 30 minutes after starting the transfusion. So, and it is said that whenever you give a mismatch or a wrong blood, when the amount of blood transfused is less than 50 ml, most of the time you will be able to revive the patient. So when your transfusion rate is very slow initially, you can, even if some mild reactions happen, it's easy to revive the patient. So always start the transfusion very slowly, maybe at the rate of 1 ml or 2 ml per minute initially for the first 15 minutes. Again monitor the vitals. Ideally it has to be monitored at 0th minute, that is at the start of transfusion, then at 15 minutes and 30 minutes, and every 30 minutes thereafter till completion. And whenever the rate or the infusion rate is slowing down, the important things that you have to check are, check for the patency, whether the administration set or the cannula is patent enough. See if there is any kinking. Sometimes you may have to elevate the blood product above the certain level of the patient just to allow the gravity to allow the blood to flow. Look for air, bodies, clot or debris in the blood bag or the administration set. and also check your pumps, the infusion pumps are working well. And if all these are not sufficient enough, you may have to sometimes think of diluting the blood by adding normal saline. So as I said, you should have explained the patient about the various transfusion reactions that can happen. So once you have started, look for all these telltale signs of transfusion reaction, any new symptoms arising or signs after the starting of the transfusion, any change of vitals that you have noticed, and whenever, as shown here, the allergic or the febrile or the hemolytic reaction with various things like chest pain, apprehension and low backache, the first step, whenever you notice or get a hint of transfusion reaction, the first step to do is just stop the transfusion. You don't have to necessarily disconnect the patient from the blood, but just stop it and call for help either from a physician or an assistant or an attendant who is required. So once you do that, you have made sure that everything is going fine, then probably after 30 minutes slowly increase the rate of transfusion so as to complete your transfusion within 4 hours. And then coming to the most important thing, document everything that you have done. What are the things that you should be included in the documentation of transfusion? Write down the order, what was the order as to what to be transfused and all that. Document the consent, what is the type of the component, identification number, what is the volume transfused, date and time, and also pre and post transfusion vitals. And at the completion of the transfusion, mention the condition of the patient as to was there any problem during and how was the patient at the end of the transfusion. And the transfusionist has to sign, and also adverse reactions, if any, has to be noted down. And once there is adverse reaction, stop the blood, call for help, and once you have made sure that you can also intimate the blood bank immediately as to such and such reaction has happened or what symptoms, what they think of it. And once the blood bank goes through the records and make sure that there is no mismatch or something, you can probably continue the transfusion or act accordingly. And now, whenever you want to transfuse, what are the rates that you are going to transfuse? Sometimes, as I said, the ideal is to run the transfusion somewhere between 2.5 hours to 4 hours. But sometimes, especially in casualty or intraoperative bleed where the bleeding is happening at a very rapid rate, you may have to transfuse the blood very rapidly. So how are you going to transfuse the blood rapidly? There are pressure devices available which can achieve flow rates of as much as 70 to 300 ml per minute. So you can use those pressure devices. Also, one of the most important way of increasing the rapid infusion is said to be having a double infusion, that is, have two different sites of transfusion and or use a wild boar needle, and this is known to be very effective to transfuse blood products at a very high rate. And another important thing is whenever you are transfusing a patient, make sure that you don't transfuse something else also with that. That means to say no medication should be directly added or into the blood product or through the same infusion site. The only product or the medication that can be allowed with the blood, as I already said, something to dilute like normal saline or something like albumin. Otherwise, for all practical purpose, do not add any other medication along with the blood product either into the infusion site or to the three-way cannula that we use. Never anything other than normal saline. Then sometimes, can you transfuse outside? Yes. Transfusion may be required at an outside the hospital setting many times. Maybe it could be in transport vehicles, disaster spots, or at home. So, of course, transfusion may need to be done at these places, and it is allowed to do that. Only thing is, make sure that you have all the conditions, necessary requirements. As I said, if it is in transport way, make sure all your equipments, emergency backup and everything is working fine. And if it is in house, make sure that you are constantly under the supervision of somebody and locally some medical help is available if at all something goes wrong.